And we're going to talk a little bit more about breast cancer now, since we're almost to October, which is when we really focus on it to try to raise awareness for women to get checked and to focus on raising money for a cure. And joining us now with some of the trending topics in the breast cancer world is the medical director at Legacy Cancer Institute. And she's amazing. That's all I'm going to say. Dr. Nathalie Johnson, thank you so much for joining us today.
Thank you for having me.
You know, doctor, there are so many things to talk about in terms of breast cancer. What's top of your list right now, top of mind?
Well, I think there are a lot of new treatments coming down the line and new diagnostics, so it's an exciting time. I think immunotherapy is one of the ones that's a huge field now. So learning how we can stimulate the immune system to recognize specific things about a cancer and to be able to fight it.
To try to teach our bodies to fight it, right?
Yes, yes.
Yeah.
And it's really interesting because you think of immune therapy as just building the immune system, but it always works better in combination with chemotherapy. And the way I think about it is we've learned that some cancers sort of make a force field, like if you think about Star Wars, and you know, if they have up a force field, then the battleships can go by it and not be able to see it. So that's what happens with the immune system, is if the force field is up by the cancer, it goes by it and the cells don't see that the cancer is there and they should attack it. So by using chemotherapy, we knock down the force shield and then we enhance the immune system so they're ready to do battle. That's the way I think about it.
Yeah, that's a nice, simple way to explain it. And what do you tell women in terms of, you know, when they're diagnosed and the chance of survival, and are we getting better?
So the chance of survival is really good with breast cancer. Of course, the earlier you're diagnosed, the better. But that's one of the other things that's changed recently, is now we don't stage breast cancer necessarily by the size or actually even lymph nodes. We're learning about the biology of the breast cancer. So some breast cancers can be larger, but if they have a fairly indolent biology, that they will actually be a lower stage than a smaller breast cancer that has an aggressive biology.
And doctor, you mentioned early detection being so important. I think the good news is that we have better ways to detect it now.
We certainly do. So 3D mammography has really been an excellent adjunct, especially for women that have denser breast tissue, but even for those that don't, sometimes 3D will detect cancers that we don't see on our traditional mammography. So we really love that, and all of our breast centers have 3D mammography. But we also have a new tool called molecular breast imaging coming, and that's a nuclear scan of the breast. And what's wonderful about that is we have currently a nuclear scan called breast-specific gamma imaging, but with this newer technology, we have 2 camera heads that go against the breast, so the detection of even smaller lesions is possible. And also the radiation dose associated with this technology is much lower.
Because it's so targeted?
Yes, than the one that we
great.
have. So that's awesome, because you would like to expose people less to radiation, but still be able to do good diagnostics.
We just heard the news this morning, Dr. Johnson, that a very well-known actress, Julia Louis-Dreyfus, has been diagnosed with breast cancer. When this happens, do you see an uptick in women paying attention?
We certainly do. It reminds women that this is possible, and breast cancer is not a respecter of anybody, and that it's time to get mammography and to be screened. And in the past couple of years, there have been a lot of controversy about how often you should have mammography, but there was just a recent study, well done, published, that showed women that start at age 40 and have annual, that is every year, mammograms have a 30% higher chance of survival than women that do not do that.
You've been kind of groundbreaking in encouraging sort of additional therapies to go along with the traditional medicine, and things like massage, meditation, all sorts of things.
Yes, and right now I really encourage exercise, diet, and nutrition. So one of the things, we're very good at giving people drugs.
Yes.
But
which are critical.
Which are good,
Yeah.
and that's right, they play their role. But it turns out that getting 30 minutes of cardiovascular exercise, whether that's walking, swimming, the exercise cycle, however you want to do that, decreases your chance of a cancer recurrence almost as much as having chemotherapy.
Wow.
You know, it's so important, I feel, when we have you on, to point out that you are a survivor.
Yes.
How long ago were you diagnosed with breast cancer?
4 years.
4 years.
Yeah, I finished chemo 4 years this month. Yeah.
It gives you a new perspective, I'm sure, in dealing with your patients.
It certainly is. I've always, thought I was an empathetic physician, but putting on the shoes and wearing them does give you a different perspective. It really does.
Well, thank you for stopping by this morning, kind of kicking off our awareness about breast cancer health during the month of October.
Thank you for having me.